Hi, everyone. Welcome to Springer Nature's Q3 2023 Medical Highlights presentation. Today, we will share with you our top titles as selected by the sales and editorial teams, and we are excited to kick off with our key bestsellers for this year from Springer Nature. These are our recently published books, so all published in 2023. We are seeing a trend in artificial intelligence, personalized medicine, and especially in veterinary medicine from Springer Nature's books program. So these books certainly highlight those books that are in demand from our hospitals, our libraries, and from our key customers. So take some time to peruse and look at the titles, and we will make sure to have something, a flyer linked to this slide here. Thank you. All right, and now to kick off our forthcoming books from Springer Nature for Q3, and we will kick it off with nursing titles. So our first book here is Patients' Lived Experiences. This title is a collaborative book by bedside nurses and healthcare professionals to educate medical professionals about caring for transplant and cellular therapy patients. This is a vulnerable population, and the case study approach in this book focuses on those lived experiences in care and their care partners during this very sensitive time. The cases featured in this are unique in that they encompass a qualitative narrative developed using interpretive phenomenological analysis, which is a look into qualitative research that provides insights into subjective experiences. And this is a great book for nurses, healthcare professionals, and individuals that are interested in understanding and improving care for this very complex patient population. Our next title is The Future of Nursing 2020 to 2030, Global Applications to Advance Health Equity. This aligns with concepts and recommendations put forth in the Future of Nursing report from the U.S. National Academy of Medicine. It provides practical guidance, tools, examples, and storytelling to complement the report's goals of achieving health equity, which was highlighted by the United Nations Sustainable Development Goals. The book is written by prominent international academics and nurse practitioners, and it offers program and policy recommendations that are specifically aimed at addressing health equity. Nurses, as the largest healthcare workforce, are in a crucial position to make a difference. So this book will serve as a resource to inspire and empower them to recognize and address inequities, and it will emphasize the importance of taking immediate action to create a fair and just society. Our next title is Nursing in Prison. Nursing in prison fills a gap in the current market. There are no textbooks that explore nursing within a prison setting. It focuses primarily on healthcare provisions in the prison service of England and Wales, but also draws on examples from the United States and Australia. The book provides support to student nurses in comprehending the unique role of nurses within prisons and how different nursing specialties are applied. It also offers an overview of the prison environment, the prison population, and healthcare within prisons. It dispels misconceptions about nursing in prisons and also includes experiences and perspectives of nurses who have and do work in this field. This book is a good book for undergraduate student nurses, qualified nurses, and individuals that are interested in pursuing a nursing career within a prison setting. Our next title is Item Writing for Nurse Educators. Item Writing for Nurse Educators is a valuable resource for nurse educators teaching in professional environments that need to write effective assessment questions. It covers the fundamentals of item writing and aligns questions with the Bloom's taxonomy to ensure that the appropriate level of cognitive engagement is appropriate for the learners. So the book offers STEM examples and addresses new types of questions expected on the NCLEX exam. So this is the National Council Licensure Examination for both registered and practical nurses. So this is a good title for nurse educators at various levels, from undergraduate to continuing education. These are nurses that are responsible for evaluating student learning through assessment. It is especially beneficial for educators preparing students for their licensing exam in the USA and Canada. Clinical reasoning and evidence-based practice helps to improve the quality of clinical reasoning among nursing students. So that will help them lead to better decision-making and higher quality of care. It teaches students to recognize when clinical reasoning is needed and what reasoning is involved and how to avoid reasoning errors. The book utilizes 4 sets of standard questions based on the current knowledge out there about learning complex cognitive skills to boost clinical reasoning abilities. The book includes a section on evidence-based practice, which is suitable for both early and later years of nursing education. And additionally, it teaches students how to read and critically appraise scientific articles and evaluate its applicability to their own practice. So very important to emphasize the value of research literacy, and this book is the perfect tool to hone in on that skill. And then the next title we have is Mentoring in Nursing Through Narrative Stories Across the World. So this delves into concepts of mentoring, its theoretical foundations and its applications to improve patient care and healthcare outcomes. More than 300 mentors and mentees have contributed globally to their experience and reflections on mentoring. So the book does showcase stories of mentorship in leadership, clinical practice, education, research, and politics, and it provides a diverse and inclusive collection of narratives. It also emphasizes the role of mentoring in supporting nurses' professional and career development. So nurses at all stages in their career, including early nurse careers, emerging leaders, and nurse educators, policymakers, and nurse scientists will find this to be a helpful resource. The book additionally aligns with the vision set forth in the Future of Nursing 2020 to 2030 report, which emphasizes the need for mentoring to shape the future of nursing and achieve health equity. All right, thank you. That was all of the nursing titles that we've highlighted for Q3. Now I'll hand it over to Madeline to share the next series of titles in our list.
Thank you. Yeah, so next we have magnetic resonance imaging of congenital heart disease. This is a heavily updated second edition with up-to-date information about the use of MRI for evaluating congenital heart disease. It provides an overview for students and professionals covering cardiac, MRI, imaging in pediatric and adult patients with congenital heart disease. MRI technology has become critical to managing congenital heart disease, and understanding its uses and its most recent developments is very important in understanding the field and the treatments required. So this book will be a useful resource to professionals in imaging or cardiac clinicians and also students in the field. Next, we have Stress Echocardiography. This is the 7th edition of a wide-ranging and widely praised book. It has translations into 6 languages and contributors from 20 different countries. Stress echocardiography is the process of using an ultrasound to show how the heart muscle pumps, which reveals any abnormalities. The first edition of this book came out in 1991, and the 7 editions since then have covered a lot of change in the field. This most recent edition also covers the variety of new technologies emerging in the field of stress echocardiography and the applications for different kinds of patients, from athletes to patients with heart failure. So wide range of severity in complications that this book will prepare professionals for. So this new edition includes 300 figures, 150 tables, and video clips that enrich the text. NERVE is a personal account of Dr. Michelle Pato's experience with traumatic brain injury. Her unique insight as a doctor in psychiatry gives this account of her experience a level of clinical understanding of issues she faced, such as aphasia, neuromuscular and memory issues, tinnitus, and vertigo. And so all of this all of this clinical understanding is alongside the narrative of the physical, psychological, and emotional challenges that she faced during her recovery. So it gives a really broad, really detailed, and nuanced overview of this experience. So it's a very powerful and engrossing narrative, and it can also serve as an educational tool for clinicians treating traumatic brain injury and patients and caregivers who are affected by it as well. Next, we have controversies in clear aligner therapy. Clear aligner therapy is the popular new dental treatment that involves moving teeth into alignment without braces, instead using see-through plastic devices that fit onto the teeth. Issues this book addresses include technical problems and limitations of the device and how it compares to other orthodontal treatments like braces. The book doesn't advocate for one treatment over the other, it just presents the benefits and limitations for readers to better understand. And it also provides solutions and strategies that practitioners can use to avoid common issues that arise. Authors Dr. Anderson Huang and Dr. Darren Huang are both professors at the NYU College of Dentistry in the Department of Orthodontics. And I will pass it to Nick.
So next we have 3D imaging and endodontics. Endodontics is a branch of dentistry that focuses mainly on the dental pulp and tissue surrounding the roots of a tooth. Repairing tissue inside a patient's teeth is a very complex subject and helps patients with extreme tooth pain as well as any small infections that can build up and create even worse issues. This title is about the usage of 3D imaging to get more in-depth detail and information about the causes surrounding patients without actually having to operate on them. Because endodontics involves such sensitive procedures, it is best to have something to practice on or a model to have on hand. This book helps shorten the learning curve for involving 3D imaging with endodontics. This book is targeted towards clinicians who are long accustomed to working in three-dimensional spaces and applications and have also worked with the constraints within two-dimensional imaging in the past. It is building on a previous edition with more updated information and helps to master the new technology even more. Next, we have medical education and geriatrics. Geriatrics is the branch of medicine dealing specifically with the health and care of elderly patients aged 65 and older. This book provides an overview of strategies based on studies for teaching geriatrics and medical education courses. It's also important because it helps with teaching a branch of medicine that cares for roughly 10% of the world's population, and as much as 18% in some first world countries. It is an ever-growing field as people are living longer and longer due to modern medicine. This title supplies strategies for teaching geriatrics based on a variety of settings, including the hospital, nursing homes, home care, and telemedicine. This book is for clinician educators, whether it be for someone who has been pursuing education in this field, or even for someone who is seeking to expand their current knowledge and teach it to current medical students. Next, we have case-based gynecological oncology. Gynecologic oncologists are doctors who have specific knowledge and training in diagnosing and treating cancers of the female reproductive organs. These issues are more important to tackle and are more unique in the field. In this book, there are a number of case studies and resources detailing the most up-to-date strategies that are applicable in this field. Each chapter has a different pathology and analysis of scenarios that can be encountered in a gynecologic oncologist workday. Cancers present in the female reproductive system are a difficult issue that requires more decision-making compared to regular gynecology visits. This book is a resource targeted towards the gynecologic oncologist that may have to deal with the specific scenarios and cases in the book during their day-to-day practice. I'll pass it back to Jenny.
Okay, thank you, Nick. And we'll move into non-invasive mechanical ventilation and neuropsychiatric disorders. So this one explores the relationships between psychological response patterns in both acute and chronic respiratory failure. It analyzes the vulnerability to stress, critical illness-related psychological stress, and susceptibility that may arise during a non-invasive mechanical ventilation support. So that's the oxygen mask rather than cutting a hole to the trachea. Insights into the most frequent indications for NIV, including its use in pandemic and high-risk infections, as well as acute and chronic respiratory failures and neurological disorders are shared here. It highlights the practical approaches for treatment and prevention of neurologic and psychiatric disorders during NIV. So this is a great valuable guidebook for healthcare professionals, including neurologists, psychiatrists, pulmonary care professionals, geriatricians, internists, and psychologists in their clinical practices. The next title we have is Ethics in Intensive Care Medicine. So Principles of Clinical Ethics in Intensive Care Medicine is a part of the European Society of Intensive Care Medicine textbook series. It explores the fundamental principles of clinical ethics and ethical reasoning in the context of intensive care medicine. It addresses the decision-making process, including the complexities of limiting life-sustaining therapies and integrating palliative care. It addresses what happens when widely accepted ethical values and principles are challenged. An example of that could be the COVID-19 pandemic, where clinicians were forced to elaborate their recommendations regarding the prioritization of scarce resources. So this is a great title for clinicians working in intensive care, including nurses, respiratory therapists, and other healthcare professionals who will need to enhance their understanding of ethics for addressing clinical dilemmas in their care. All right, our next title is The Clinician's Manual Treatment of Hypertension. Hypertension is a widespread condition that affects individuals of all ages, ethnicities, and socioeconomic classes. So this title is relevant to all clinicians, as nearly everyone encounters patients with hypertension in their practice. The pocketbook serves as a comprehensive resource for clinicians in screening, assessing, treating, and monitoring patients with hypertension. It provides up-to-date clinical guidelines and best practice recommendations, ensuring that clinicians have the latest information to deliver optimal care. In addition to covering the fundamental aspects of hypertension management, the book highlights prevention strategies and recent drug developments. It provides insights into the advances of the past 5 years so that clinicians are informed about the latest therapeutic options. This is a perfect title for clinicians across various specialties, including primary care physicians, internists, cardiologists, and much more. Our next title is The Pocket Reference to Asthma. It offers readers a complete overview of asthma, covering its background, treatment options, emerging therapies, and alternative therapies. It is a comprehensive resource for respiratory specialists and healthcare workers seeking a quick reference tool for asthma management and treatment. The text is designed to be a quick reference tool for busy professionals, so there are full color tables and figures to facilitate better understanding and retention of information. It's primarily targeted towards respiratory specialists and healthcare workers, but it can be beneficial for anyone in the management and treatment of asthma patients. And our next title is Extreme IR. Interventional radiology is a medical specialty that performs various minimally invasive procedures using medical imaging guidance. So Extreme IR will represent the 101 exceptional cases in the field. The cases are handpicked from internationally recognized extreme IR events and from the Journal of Vascular and Interventional Radiology. The cases presented offer readers access to rare and remarkable cases that showcase the cutting-edge advancements in the field. So the book is divided into 12 sections, and each section is accompanied by bullet-pointed text, providing a concise and focused presentation of the essential information and visuals that facilitate better understanding of these complex procedures. So this book is aimed for radiologists and endovascular specialists at all levels of seniority and training. Okay, now over to Madeline for next titles.
Great. Next, we have nuclear medicine technology. Nuclear medicine is the practice of using radioactive material inside the body to show how organs or tissues are functioning for diagnosis, or to target and destroy damaged or diseased organs or tissue for treatment. This is the 6th edition of a book that prepares students for registry exams in nuclear medicine technology. So it's a test prep book that includes practice questions and answers and a mock registry exam. This new edition includes new tracers for diagnostic imaging and therapeutic applications, and more newly approved procedures. This is an essential book for any student of nuclear medicine technology preparing for their exam. Next, we have digital eye care and teleophthalmology. Telemedicine for eye care is an increasingly popular field, but as with all telemedicine, not being in person presents challenges that require digital solutions. So this book provides strategies on digital eye care solutions for front of eye and retina exams, including covering any technical issues, digital imaging, and experiences of practitioners around the world with different amounts of access to digital resources. So explanations of how to perform digital eye screenings and virtual image reading are provided. And overall, it's an essential resource for professionals involved in eye care who are seeking to develop or improve digital eye care options for their patients. Next, we have ocular trauma and armed conflicts. War conditions present a whole range of possible traumas to the eye that clinicians in peaceful regions will rarely encounter. This book outlines step-by-step evaluation and treatment plans for injuries to the eye from wounds sustained on the battlefield, management of polytrauma for injuries to the head and neck that also affect the eye, and ocular trauma due to chemical, biological, radiological, or nuclear hazards. And it also includes information on cosmetic rehabilitation for severe injuries to the eye area. This book will be a helpful guide to ophthalmologists, trauma care workers, medical officers, and medical officers within the military. And next we have emerging technologies in oral and maxillofacial surgery. Oral and maxillofacial surgery includes operations to correct diseases, injuries, or defects in the face, jaw, and mouth. It's been a developing field, and the most recent development includes the introduction of personalized medicine. So this book identifies emerging technologies and reconstructive treatments, implant dentistry, and more, walking the reader through the workflow of these new technologies. This book will be a very useful resource for oral and maxillofacial and plastic surgeons, as well as fellows in the field. And the last one from me is Orthopedic Rehabilitation. This is a pocket-sized guidebook, and it's meant to be a practical handbook on the principles of orthopedic rehabilitation for residents and fellows. It presents treatment protocols for common injuries, identifying physical therapy measures and timing required before returning to routine activities or sports. It focuses on upper and lower extremities, hip and pelvis, and spine injuries, enabling clinicians to quickly reference and make decisions for their patients' treatment for these common injuries. And I'll pass it back to Nick.
Okay, so next we have ENT board prep. ENT is a field of medicine where trained doctors deal with diagnosing and treating the ear, nose, and throat. Doctors in this field deal with patients who have hearing and balance disorders, as well as smell and taste problems. There's a wide range of illnesses and it can even cover head and neck tumors and can be causing these issues as well. Because of this, it is a very important field where doctors are needed on a regular basis. The target audience would be for medical students studying for their exams. The book covers sections for cancers, ear, sinus, plastics, sleep, and throat, and even has case studies for those studying specifically for the oral board exams. It also serves as a basis for a background of what pre-med students should be preparing themselves for. Overall, ENT board prep is a title that serves as an ideal study guide for the ENT in-service and board exams. Next, we have Introduction to Artificial Intelligence. Artificial intelligence is a rising topic, and every industry is trying to use its capabilities to improve their own work processes. This book tackles the topic in relation to medical imaging and how it can benefit physicians and scientists. The layout of the title goes from explaining basic terms in artificial intelligence to a novice reader, to even advanced, where it goes into specific language processing that physicians would need to implement in their system. AI can serve as a tool to work with pre-processing data that is used in regular medical imaging and validated before it's used in a medical setting. Not only will patients get more accurate diagnoses in their medical screenings, but the process will be even faster and cut out time that patients may have lost when they should be getting treated. This book is a valuable resource for radiologists, computer scientists, and postgraduate students working on medical image analysis. This title was written by the chief resident of the radiology residency program in a leading hospital and institute in Greece that wants to improve processes and hopes to spread the vision and knowledge widely in the medical field. Lastly, we have the ABSITE blueprints. The ABSITE stands for American Board of Surgery in Training Examination. It is an evaluation given to all surgical residents as an assessment tool for residents and their programs. Dr. Hannah Ajus, the author of this title, came upon an idea for this book when they came across many general surgery residents who were seeking a good ABSITE review book but didn't have one available due to their out-of-date resources. This book serves as a concise and easy to use book that has up-to-date references and includes new findings as well as new methods compared to previous books available to students. Each chapter in this book is reviewed and written by someone who has expertise in his specialty. The Absci Blueprints is a title that is very valuable and is a much-needed update to the current curriculum of studying for the surgical examination. It is targeted towards students looking to update their knowledge, as well as educators to be a guideline for teaching with up-to-date material.
Okay, great. Thank you so much, everyone, for joining us today. If you have any questions or material requests, please reach out to sales@springernature.com. Thank you for joining us and have a lovely day. Take care.